What if the key to healing or vibrant health and a resilient immune system isn't found in a supplement or medications, but it is in your body's own healing code? What if that is called a peptide? Well, today, Dr. Jennifer Gramith she is our body whisperer. She's back to talk about the healing codes of that's in us using peptides. Dr. Jennifer Gramith is a naturopathic doctor and a lymphatic therapy expert who will help us uncover the fascinating code that what happens in our body when we use peptides. So get your paper, your pen, and anything that you want to write with, your recorder, save it, share this with your friends because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lily McDermott, and I'm a certified life coach, a holistic cancer coach, and the host of the Lily McDermott Radio Show. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace the new truth and live the life of your dreams. Well, as I mentioned, Dr. Jennifer Gramith, naturopath from Georgia, that you can from anywhere around the world dial up and get to know her and her team at Rightway and Health and Wellness. They're able to listen to you and see what it is. It's like having a puzzle, what it is that your body is needing. And when you give the body what it needs, it is amazing how forgiving and loving it gives back to you and it loves you back. And so today we're going to be talking about peptides and how they are active in our body or they're dormant in our body. I have no idea because Dr. Jen is going to be our expert today telling us about what to do. She's probably going, Lillian, you don't know anything about peptides, but she is going to set us straight. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Jennifer Gramith is here to do just that. How about them apples? I have no clue about
Awesome.
peptides. I tried to bluff my way through it and failed miserably. But you know what? If I can't laugh at myself, who can I laugh at?
Well, you're not alone. You're not alone. Most people don't know what peptides are. They don't know anything about them. All they've heard is Ozempic, and the craze about that particular peptide. So I kind of want to just educate the public on what these peptides are for. Are they dangerous? Are they good? Can they help you? Can they hurt you? Because this is, serious questions that people need to be asking before, broaching into that world of peptide therapy. But I will tell you, it's been around in functional medicine for years. Functional practitioners have been using peptides for restoration medicine for decades, over 3 decades that I know of. And so all a peptide is an amino acid chain. And so you know about amino acids. They're the building block of um, every function in the body. So they're very, very important. And a peptide is anywhere from 2 to 50 amino acids. Above 50, it turns into a protein. Okay, so that's the difference from a peptide to a protein is the amount of amino acids strung together on that chain. And but there's a lot of benefit that we're going to talk about 4 peptides today that are really important. Of course, we'll talk about the GLP-1s because that's the craze. And then we'll talk about some immunity peptides that I have found to be very effective and what they actually are used for. Um, So yeah, I'm excited to
I
share
am
this.
too. I just learned something new right now because I've always been confused about these amino acids and how many there are and you said it's from 2 to 50, but then if it's above 50 it's called a protein. How,
Hmm.
why didn't I know this? I mean, I've been doing this for a long time, but peptides are really new. And the
Yeah,
first time I heard about peptides, and the first class I did on peptides was probably maybe 4 years ago, 3 years ago. And I didn't get it. I didn't understand it. And then there's
it's a lot.
GLP-1. Yeah. Then the GLP-1s are coming, and there's a lot. Let's talk about the amount, the dose,
Right.
GLP-1 versus a peptide that you're talking about. Let's talk about the dosing and why GLP-1s, the way we know it today as Ozempic and Mondovi or whatever those names are, what is the difference between the two?
Yeah, so in functional medicine, we microdose everything. And so peptides are naturally, like GLP-1 is produced in our belly. And so as we age, we produce less. Certain environmental factors can affect the body's ability to produce these peptides, and peptides are messengers. There are signaling process. It signals this response or this response in the body. So they're very important. And that's why when we talk about metabolic disease and 90% of the population having metabolic disease, it's partly due to the breakdown of these peptides. They're not sending the messages that they once sent before. And so there's a lot of confusion. It has ill effects on the immune system. It can cause damage in the cardiovascular system. It leads to all chronic illnesses, diabetes, heart disease, cancer. So if you want to, if you think about a business and you're wanting to get your business up and running, you're going to have to set systems. There's going to have to be communication between people and, things going on in the office. Is the same thing in the body. The peptides are the messengers. They're the key to the proper communication between the cells and the mitochondria. So yeah, it's, GLP-1. I don't know what happened, why, they all of a sudden decided to just mass market this particular peptide. It's partly due to the rate of obesity in our country. And they're just trying to figure out how do we knock the obesity rates down very quickly. And so, peptides, when used properly, are very effective. And GLP-1 is a great peptide. It's been used, like I said, in microdosing for years. It has the ability to restore cardiac function, to repair kidney damage, to help with pancreas dysfunction and diabetes. It's known as a type 2 diabetic peptide, but it does have a lot more benefits than just that. It helps to reverse insulin resistance, which is, you and I have talked a lot about being the cause of many chronic illnesses. And it's a real struggle. So it's a key peptide in metabolic health. And so it's not just for weight loss. And you don't need to just use it for weight loss. That's a great side benefit if you need to lose weight, but it's not necessarily the only thing that it's good for. Um,
Yeah.
I will say this, macro dosing this peptide is what can be dangerous because of muscle wasting, gastric shutting down. You want to delay, and a lot of people gastric emptying because they have damaged their gut so much
Hmm.
that when they eat, they don't absorb anything from the foods that they're eating to gain nutrition, and so you want to slow it down so you have more time to digest it and absorb it, but you don't want to shut it down. So when you do a high dose of GLP-1, you can actually shut it down. And that's when people have the symptoms of nausea and vomiting, and they lose a lot of weight really quickly. And it's not just fat mass, it's muscle mass. And that's the last thing that you want to lose is muscle. You want to build muscle, lose fat. And you can't do that when you're doing macro dosing of this peptide. Yes, you will lose weight very quickly, but it will not be safe, in my opinion.
Mm-hmm.
And one of the most important muscles in your body is your heart. You
Mm-hmm.
definitely don't want to cause atrophy of that muscle, and that can definitely happen with
Wow.
long-term use of the high dose peptides. And so you're better off to microdose these things. It's a great peptide to help with a lot of conditions, but you want to start microdosing. So macro doses, like 12.5 milligrams, and then micro dose would be like 0.25.
Wow.
Um, so it's a big difference.
So what
And
was
we
the
don't,
macro dose of equivalent is what?
12.5 milligrams typically is
Versus
what I was thinking.
0.25 milligrams.
Yeah, so not even, yeah, it's a fourth of, 1 milligram. I mean, and the highest we would go would be like 1.25 milligrams. It just depends on the person and what they're trying to achieve. So you really want the guidance of a practitioner who knows what these peptides do, how they interact with the body, and then that is very mindful of just, doing just enough to get those systems talking again and functioning properly like your own natural body would if it, hadn't been broken down by environmental toxins or stress or dietary things.
Yeah, yeah. And so okay, so with GLP-1 that we've heard all about in the latest craze is to me, unless you have diabetes, and now they're putting people that are diabetic that have been on diabetic medications their whole entire life, they're putting them on that and they're losing weight, they're releasing weight, they're doing all this stuff. Is it better when somebody has diabetes to do the macro dosing? Try to say that 10 times. Macro dosing. Is it safe for them to do that, or should someone who has all these conditions that you talked about, diabetes, pancreatitis, or whatever problems with their
Right.
pancreas, is it better for them also to microdose?
In my opinion, in my experience, it's better to start micro dosing and then you can gradually go up as needed, but you want to stay on the lowest amount possible instead of starting everybody, the general population, on a macro dose.
Hmm.
You want to be careful. And, most doctors will do that. They will be more cautious, but they do go up very quickly, I have seen, and
Yeah.
the majority of the population to that high dose, and people are very symptomatic. And so you're trying to cut down on that. So I am not of the mindset that macro dosing is necessary for pretty much anybody. I want to do the lowest dose possible to get the results, and you should be monitored. So this is one of the GLP-1, which is a glucagon-like peptide. That's what it stands
Hmm.
for. It will actually lower cardiac markers. So when we run these cardiac IQ tests on people and we see high lipoproteins and high, the small and moderate molecules of cholesterol being really high, which puts them at high risk
Hmm.
for heart attack or heart disease. You can actually monitor that and see a reduction of that within the first 30 days and then 60 days. And then, my suggestion is people to be on these for like, 2 to 3 months, then take a break. And then if they need to do it again, they can. But it's not a lifelong thing like they spin it with a lot of them. Because if you take such a macro dose and then you stop, then you're probably going to gain, especially if you haven't made the lifestyle changes
Correct, correct.
necessary. And what I've seen too is a lot of people just aren't eating because they have zero appetite, and every time they eat, they get nauseous and start vomiting with the macro dosing. And it's we don't want that. Well, I mean, that would put them in malnutrition. And so we're trying to build health. So again, you just use what would naturally be in the body if it was functioning properly. And those are just little micro
Okay.
amounts, and it can be very effective, very effective.
So let's continue with this concept of the GLP-1 as
Okay.
a microdose. So at the beginning of the class today, I said, what if we had something hidden in our body that we can turn on and turn off? Let's call it a peptide. That's what you're
Hmm.
talking about. We're talking about peptides today. And so, if I have peptides, I heard you say clearly that when you're younger, you have an abundance of it, but as you get older, it slows down. Is that why, as women get older, typically we get bigger in the midsection?
Yes, yes, yep, very
So,
much so.
so talk to
Hmm.
me about a microdosing peptide that is this a synthetic peptide that is very similar, or is it a bioidentical peptide, the ones that you have at
It
Rightway Health and
depends.
Wellness?
Yeah.
Okay.
Yeah. It depends. So some of them are synthetic, made as close as to our natural peptide as
Hmm.
possible. Some are
Hmm.
plant-based, some are animal based. So it just depends on the peptide that you're looking at. The GLP-1, when you microdose it, the benefits you get from it is it improves insulin sensitivity, which is a huge factor. Stabilizes your blood sugar levels. I've not seen anything stabilize it as quickly as the GLP-1s, and reduces inflammation. And by reducing inflammation, you modulate your immune system, so you support your immune function, and it lowers your cardiac risk. And it also helps with cognition and brain health. And a lot of people don't realize that because your brain no longer is on fire. And so, and then you feel full. So you make better choices. It takes away cravings of foods that you typically like. I gotta have that bag of chips or that sweet ice cream, because I'm sad and it makes me feel better. You have those cravings that are kind of just dissipate. And so that's one of the best things about it is that people make better choices. I wouldn't recommend it to a person who thinks that they can just keep with the standard American diet. This is for people who have really, really struggled with diet changes, and they still can't, get their cardiac markers down or their insulin resistance under control, or, their blood sugars leveled out. So, and they can't lose weight. And they're really, really struggling. And all that excess weight is really putting them at a higher risk. This is when it's appropriate to use these type of peptides for those type of patients. But that's a lot of the population today.
Yeah, it is. And it's kind of scary. I was just talking to someone today, and I was saying, we spend, let's say, for example, a person might smoke their entire life and all of a sudden they get cancer, or they might eat a certain way and they get a clogged artery. And we do things where we don't exercise, and then all of a sudden we're gaining weight. And those are, so you look at your life and you don't even think 20 years down the road, 10, 20, 30 years down the road, what is this going to be? What is my body going to look like as a result of the consequences of my choices that I've
Right.
made? So when
Mhm.
I am looking, when I choose something for my life and I see somebody that's older than me, maybe 20 years from now, I look at what they're doing today so that I
Mhm.
can see what their life was going to be like 20 years from now. And
Right.
it kind of is like they're my teachers, and it kind of regulates me to want to do better, to choose something different. But there are certain things, hormonal changes in women. There are a lot of other things that are beyond what are some of the other peptides that might help the body, build muscle? And of course, you have to exercise. And like you said, diet changes. And so what are is there anything else other than the GLP-1 or
Oh
what
yeah.
you call the
Yeah.
glucagon? Okay, so what else
Yeah.
would
So
you?
yeah, there's lots of, there's probably about 150, 170 peptides in use. So there's a lot. So we're talking about four of
Name them
them, but
all. Name them all.
yeah, yeah,
Yeah,
good
no,
luck.
I'm just
But the ones that I was really, really interested was
yes.
the immune peptides, and that's a TA1 and a TB4, which TA1 stands for thymosin, which thymus
Hmm.
alpha 1. And it's amazing because this peptide, when we are born, our thymus gland is quite large. And as we age, it shrinks to where you almost can't even identify it. Those are where your T cells, your natural killer T cells kind of hang out, and that's your immunity, your army of defense. And so after puberty, it starts to go down, and you really can't stimulate more production. You kind of have to just circulate the amount of T cells, natural killer cells that your body produced prior to that. Well, with this peptide, this thymosin alpha 1, it actually boosts T cell function and natural killer cell activity. And so it just really turns back on your immune system and says, hey, I need more, help. And it helps to direct. But the best thing about it, Lillian, is it's immune modulating. So if you have an overactive immune system, so all these mast cell patients, that are really struggling, they're sensitive to everything, autoimmune, it brings it down to where it should be. If you have a
So are
weakened
you talking
immune,
about allergy sensitivities like multiple chemical
right,
sensitivities and all that?
right.
Okay.
All this. Yeah, and those are usually mast cell patients, so they just react to everything because their immune system would be considered just
Hyperactive.
overactive.
Okay.
Then there's the underactive, the weakened immune system. It will bring your level up to optimal. So both ways, modulating means it brings it to where it needs to be for optimal health.
Hmm.
So that's what's so beautiful about the thymosin alpha 1 is it can do that. It's been used in cancer studies for patients using immunotherapy and chemotherapy and boosting their immune system to help their body fight off those cancer cells and tumor cells and beautifully. So lots, and it's also been used in a lot of cases with Epstein-Barr hepatitis, Lyme disease. So this is the one of my favorite peptides. And if you look at the research, it is phenomenal on how quickly it can work. And these peptides are not meant to take the rest of your life. You do a series. So usually a lot of these peptides, like the immune peptides, you would do for 6 to 8 weeks or maybe even 3 months at most. And then you take a break, and you may, in order to keep your immune system up to optimal levels, you may do that once a year if needed. So you really will work with your practitioner, and they will help you to
Hmm.
understand how often, what dose you need. And yeah, and it works very, very, very quickly.
That's
So
great news. That's great news. So can you give somebody with pancreatic cancer the TA1 TB4? Can you do that?
yeah,
And
yeah.
can you
Well, the TA1, yeah, definitely on the
TA1?
TA.
Okay, so they're different. Okay, I
There's
thought they
different peptides. There's the function of, you have to understand the pathways of these peptides to
and I
understand
don't.
what's appropriate for which type of
Clearly I
person.
don't.
Yeah, so the TA1 really is good. Like I said, immune modulating
Uh-huh.
works on most cases. It's very safe to take, and the TB4 pretty much is too. However, with TB4, we're a little hesitant because the studies haven't kind of concluded because it actually supports angiogenesis. So it's really good when you're trying to heal
Okay.
something, but not so good, may not be so good if you already have a tumor,
Yes.
because
You
it
don't
can
want to
increase.
support that. You don't want to support
That's
the
why you
tumor.
were
Okay.
trying to shut it off. But now, in some of the studies, it shows that it helps to, modulate it. It's more of, it doesn't create support for that malignancy or whatever. So, that's the jury's still out on that. But as of now, we wouldn't use the TB4 for someone with cancer. We'd use
But the
one. Yeah.
TA1 you can. And so thank you for that. So if somebody, because I've heard so many times people say the dose is the poison. The dose is the poison. Boy, I'm having
Yeah.
tongue twisters today. So with that in mind, if somebody is on chemotherapy and they want to do the TA1, would you start them at a 1 point, like a 0.25 or a 1.25? What would you do with them?
So there's different protocols for different scenarios. So it depends on the chemo agent drug that they're using. It depends on the stage of the cancer. But yeah, there are definitely protocols that we would use. TA1 definitely would be used in a support role for the immune system for a cancer patient of most types of cancers. And then,
And Epstein-Barr and
yeah,
all these other
all
things.
of
Because I would
those.
love
Yeah.
to look into that for
Yeah.
me. Yeah.
Yeah, so it's different, that's why you have to work with a practitioner,
Yeah.
to understand your case and what your dose should be and how to monitor you to make sure it's achieving what it needs to. And a lot of practitioners will stack these
And that
peptides.
was my next question. Yes.
Yeah, so a lot of them will stack them. I'm more hesitant. Because number one, if you're taking three different peptides all at one time and you react to one, you're not going to know which one it is.
Hmm.
And less is always best. We don't necessarily want to give you every peptide for everything, even though as you start studying them, Lillian, I'm like, I want that one. That one increases your telomeres. It helps with anti-aging. It gets rid of, I want that one. I want that one. I want that one. But there is a way, a method to the madness of peptides and uh, how you should, dose it out. But I usually start with one and then add another and then another if
That makes
needed,
sense. Yeah.
so that I can measure how they responded to it. The TB4, which is thymosin beta 4, it accelerates wound healing. So if you have clients, and I see this a lot with like leg ulcerations, it's very beneficial, even, colitis, ulcers in the stomach, things like that. It's very helpful in to accelerate the healing of that wound. So is PC 157, which stands for body protection compound. It also is really, TB4 is used for a lot of athletes that have a torn muscle, tendon, some kind of
Well, that makes
ligament
sense. That makes sense.
issue.
Because if it's
Yeah,
wound care, yeah, that would make
yeah.
sense. Yeah.
And it works very quickly. And when I say quickly, I mean within that day, you can see results. So,
Oh.
and then as you do the whole series, you need to commit. It's not a one and done kind of, thing. You do the whole series, but you get immediate results as far as how you feel. It also TB4 reduces scars, old scars and new scars.
Oh.
So, some practitioners are using them, after surgery to just minimize the scar tissue. I think that is great. You can go online and see before and after pictures of, people who use these peptides. In many cases, you can't even see the scar from the surgery.
That's
Uh,
amazing. Amazing. Go ahead.
yeah. And then, again, it helps decrease inflammation systemically and locally. So, a lot of these peptides you can inject into your stomach, and then other ones you can actually inject it to the injured area. But most of them are sub-Q. So
Oh,
it's
so
like
it's
a
not a
little,
pill. It's not a pill.
there are some oral peptides, there are some intranasal peptides, and then there's most of them are injectable.
So just to be clear, I just want you to make sure that you know that you can get all these peptides at Rightway Health and Wellness. Go to shoprightwayhealth.com. Make sure you put the 20% Lily 20 so you can get your 20% off and be able to start saving and schedule your time so that you can learn which peptides, whatever condition you have, because one size does not fit all. And that is one of the things that we have discovered at whenyouneedafriend.com, at the Lillian McDermott radio show classroom, that one size does not fit all. You
Mhm.
might do well with one thing, somebody else might do better with another thing, but that doesn't make it wrong or right. It just makes it true to you. And targeted medical help is what you get with Rightway Health and Wellness. They look at you, the person, they don't just treat a disease. They look at you and your deficiencies. And so I want to encourage you to call 474-474-2100, or you can go to rightwayhealthandwellness.com. But all the products that we're talking about today, and I'll verify that with Dr. Jen in a little bit, you can get at shoprightwayhealth.com, and you can use Lily 20 and get 20% off. While you're at whenyouneedafriend.com, make sure that you subscribe to my website, like and follow me on all social media, support Dr. Jennifer Gramith as she is supporting the classroom. This is information for you that is free for you to learn and grow. So support our sponsors the way that they are supporting the classroom, especially Dr. Jennifer Gramith, who's been with us for such a long time. And I know all of us are smarter because of it. And so Dr. Jen gives of her time, and we just need to give back to her. And so other thing that you can go to is my Shop Now bag and check out all the Lilly approved products from head to toe. That's another way that you can support the classroom and let the classroom grow. And sharing this video. I know you know someone that's in her middle age that is getting the middle age spread right around here and saying, hey, you need to call Dr. Jen and find out how these peptides, these micro doses of peptides can help do whatever we're doing and make it like take us to that next level. So check out the Shop Now bag. Last but not least, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month, a one-time donation, whatever you can do, whether it's your time, your talent, your treasure, all of it helps grow the classroom. Again, like I said, share this video with your friends because this is how we continue to grow together, as well as you sponsoring us in whatever way that you can. Today we have Dr. Jennifer Gramith in the back in the classroom. You can find her at Rightway Health and Wellness. You can get these peptides. Are all these peptides that you talked about today, are they part of the Shop Rightway Health?
Well, so with the peptides, you can't just get them and
Okay.
not, you have to have a consult. So they
Okay.
would have to call the office, schedule a consult with one of the practitioners or myself, and then they would have be sent access to the peptides because they're not made for over the counter because they're mostly injectable,
Do you
and you
teach them
need.
how to inject it?
So we do teach them everything that they need to know in order to properly, use peptides. And so, yeah, but it does require that they go through one of the practitioners. We need to know their health history, and what they're dealing with, and make sure they're wanting the appropriate peptide. Because, like I said, there's a lot of different peptides. There's peptides for anxiety. There's peptides for, brain, neurological health. There's a lot of amazing peptides for dementia and Alzheimer's. I mean, there's so much to learn, Lily. And I think this is definitely going to be the way that medicine, goes in the future. You're seeing more and more doctors, MDs that are getting certified in peptide therapy, utilizing these in their practice. You see surgeons. Dr. Seeds is the one who did my certification program. He is a surgeon. You'll see cardiologists. And so it's becoming more and more a method that practitioners, medical doctors are actually getting into. So I'm excited, about that. And yeah, I just think people need, to be educated. These peptides are very fragile. And this has been part of the problem because the first peptide ever released was, I think, back in 1930s, and that was insulin. So
No
insulin is
way.
one amino acid. So it's really a polypeptide, but it's considered a protein too because it's more than 50. So it's 51, but it is, it's got 51 of the amino acid chains that make it up. And so, I mean, huge success, with that. But then because the peptides can be so fragile, they just kind of dropped the ball and other pharmaceutical drugs came into play and it's kind of like come full circle again. If you go online and you look at research on peptides with metabolic disease or cancer or this or that, you're going to find hundreds to thousands of articles about these peptides and how remarkable they are. And so, yeah, I think it is the future of medicine in both functional and allopathic.
I love it. I love it. So what I love about it is that it works with your body's natural cells, the natural peptides. And so what I'm hearing you say that it's similar to, so similar that it's recognized by the body as a peptide. It's like,
Yeah,
hey,
it
come
is
on
peptide.
in. Yeah,
Yeah,
it's like a relative
exactly.
just came in as opposed to
Yeah.
an alien.
Yeah, it kind of works like a tuning fork too. So, you take this peptide and it just kind of turns on your peptide activity in your body. So it kind of works as just like an instigator of these messengers to start, signaling. Again, they're drunk and lazy and they're just laying around and not doing their job. And now it's like, get up and do do something. And so yeah, it's a beautiful, beautiful thing, and in most cases, very, very safe to use these if used properly in the right doses and for the right type of cases. And so you definitely want to work with somebody that has gone through that type of certification
Okay.
where they
Yeah.
understand it is complicated, medicine for sure.
So you mentioned the BPC 157. So let's
That's
talk about that
yeah.
one because
I
you,
love BCP 157.
okay, tell me
And
more.
when we were down in I think it's Florida at the Annie Appleseed, I we were both listening to a practitioner talk about BPC and just the common peptides. She did a great job. Dr. Tracy, I believe.
Yeah,
Yeah,
Tracy
and
Straub. Yeah, she was on,
yeah, and
we did a
so
class together. Yeah.
I met a person that was, struggling with an injury, and he actually was taking some peptides, but it wasn't the right type of peptide. And so when he told me what he's taking, I'm like, "Well, are you feeling any different, with your injury?" And he said, "Not really." And I said, "Well, I think it's because you're not taking the right peptide. You need to be taking BCP 157." And I said, "And you need to, instead of injecting it in your belly, you need to inject it closest to the injured area." And it was cute because he went back, he got that, and he did it. And he sent me a email, and he's like, I cannot believe how well this helped. You are exactly right. And so it's just, picking the peptide that's right for that person and that need is critical. But the BCP stands for body protection compound. I mean, it says it all. It the oral form of BCP is amazing for gut health and to repair the leaky gut inflammation very quickly. It reduces the symptoms like within a day to 2 days in most cases. I've been amazed at that. But it also, because it's working on the gut, it also gets rid of the neuroinflammation. So, whether a person has migraines or, Alzheimer's, dementia, cognitive decline, it doesn't matter. It really makes a big difference. You kind of turn down that heat or that fire in the brain, and they can see results very quickly. My sister, I put her on an oral version of the BPC with some of the immune modulating. And she had had an ABM and had it radiated, 20 years ago, and it caused her to lose her vision. So she had optic nerve damage from the radiation. She was paralyzed on one side. And so we have done all kinds of things. Now she can walk and she can, function now, but she's still legally blind. And so I have been looking and researching things to help. I mean, from stem cells to exosomes to peptides to help repair the optic nerve and help her vision. So 1 month of taking this formulation of these stacked peptides with the BPC being the main one, she actually got some peripheral vision back. Her
Amazing.
arm, yeah, her arm that was kind of drawn relaxed. And the funniest thing, Lily, is she told me, she's like, I am using words in my vocabulary that I've never used before. I've always known what they
Wow.
meant, she said, but it's like it's changing the way that I communicate, like it's making me smarter.
Wow.
And I said, well, that's awesome. So, so we're seeing how, she responds to that. So my hopes is that it will restore the optic nerve. So there's other ones that you will start to do, and those are more focused on the optic nerve. But yeah, I mean, just that quick. I mean, she was amazed. And
Well,
if
I'm
you knew my,
amazed. I'm amazed too. And but it just goes to show us, how much we destroy our body, that if we give
Mhm.
it just a little bit of help. I mean, you're talking micro doses, very
Yeah,
tiny doses, and how
yeah.
quickly the body responds. So, what take us through the process? Let's say we want to call Rightway Health and Wellness, schedule an appointment. Let's start from there.
So
404
yeah.
474 2100. What do you do next?
So yeah, you'd call and schedule a consult. You let the front office know that you want to discuss, the benefits of peptides, and they will just schedule you a 30 minute to an hour consult. So if it's something like, just for the GLP-1s or something like that, that's a 30-minute. If you're a cancer or chronic illness, it's going to be an hour long consult for you, and that's how you get started. And Lillian, I let clients, I just send them a link to the peptides and I let them have them at my cost because peptides can be very expensive.
Hmm.
And it's more about, to me, it's more about helping the mass majority, but also just the research part of it. I am in that research mode. I want to see how well, I mean, I've read all the articles or a lot of them. I've seen other practitioners use this in their practice. This is fairly new to my practice. So, everything has to be proven to me. So if you join us in this, definitely going to get the, peptides at the cheapest price, but you are going to be part of that research. And so there's going to be several, certain expectations like labs and things like that that I will want you
And
to
that's
do.
part of the process and if they use Lily 20, the first time that they get the tell that can they use Lily 20 for this?
Yeah, so they can use Lily 20 for the console because they're getting the peptides at the cheapest.
Yeah, you're getting at your cost, so there's no sense in
Uh,
reducing it anymore.
yeah, so yeah, they're getting that at cost. So yeah, everything else, the labs, the things like that, other things that they can use the Lily 20 on for sure. And yeah, so it's an opportunity to really get educated. And that's my goal is really just education and then letting people have the knowledge to make an educated decision on what's best for them.
Hmm.
I think that for so long that we've just kind of thrown that into the laps of practitioners and, and it's not served us well.
Hmm.
We do need to be responsible. You say it all the time. We need to be responsible for our health.
Hmm.
We need to be the mastering control. Yes, you use these doctors, you get information, you make the best decision, but you don't throw off that responsibility on someone else. Nobody knows you as well as you know you. But you don't want to go into any kind of treatment or, journey without knowledge. And so this is a way for me to educate more of the, population.
No, I think it's wonderful. I think it's wonderful. So, have you, because you say you're your own guinea pig, like I'm my own guinea pig,
Yeah,
and I like to try things, and I want to see how I experience it in my body. And if it doesn't, I just put it away. I don't even bring it to the classroom. But
yeah,
there's,
something like
I just
that.
want to make sure that if it works with me, I'm a person, it'll work with other people. And so with that in mind, how much have you tried as far as peptides, and what has been your experience?
Yeah, so that's the way I am. I never try anything on anyone else unless I have tried it on myself first. Now, I haven't tried every peptide on the market, but I have tried several, and I have been impressed with all of the peptides. Some more than others. The BCP has been amazing. I still take it on a daily basis. It's one that you can take a little more long term. But I was kayaking on my anniversary and pulled something in my back, and I went and took the BCP, and within the second dose, the pain had went away. It's quite amazing. And I have taken the GLP-1s, the micro dose. I've lost 20 something pounds, and I got stuck to where, I would follow all the rules, do all, get the hormones balanced, things like that. But I would just plateau at the weight loss. And so that really made the big difference with me on the weight loss and the cardiac markers as well. And insulin resistance. And so I notice I'm not so sensitive to carbs like I were before. I can have a little bit and it not shoot my blood sugar up anymore. So that was really amazing. And so I've tried several different ones. I did this is probably too much information, but I did the TA1
The what?
to
Which
see
one? Which
how
one? The
the
what?
TA1, which is the immune peptide, the thymosin alpha. And it actually does help boost your immune system. So it actually, if you have any kind of pathogens, it attacks that. Well, one thing that I noticed was parasites coming out, and it was really interesting because I'm thinking I don't even need a parasite cleanse. It's not that time. But it actually went a little deeper than most of the parasite cleanses that I've done in the past.
Really?
I had no
So
symptoms of
since we're getting
parasite.
a little personal, what did
I
it
know.
look like?
Well,
How
what
did
was
you know it was a
interesting,
parasite?
because I've seen lots and lots of parasites, but what was interesting, Lily, is it was in the fecal matter in the stool, which is where it usually is when you do these parasite cleanses. But I also saw streams of parasites in the urine. So there meant that there was parasites in the bladder or the kidney. Too, that you typically don't see when you're doing just a general, parasite cleanse. So I thought that was interesting.
Yeah, because
It just kind of started to do.
we've done the gallbladder cleanse, and that was pretty interesting there.
Yeah,
I saved
yeah,
my little stones in the freezer. They were like my babies. I couldn't get rid of
yeah.
them. Finally got rid of them. But
Well,
no,
I
so,
don't say parasites. I get rid of
no, but
them.
did you have them assessed? I mean, what kind of
You
where
can
did you pick them
see, you
up?
can see them move. Yeah, they're not
They were
dead.
alive?
They were, because I'm not taking anything. I'm just my immune system's attacking and they're running, from that. So yeah, they were alive. But then after a few weeks of it, that I didn't see him anymore. So
So you
yeah,
got rid of them, but did you when you see a live parasite, do you think, okay, this is like seeing a baby gator, the mommy gator is somewhere around the way, you know?
yeah, yeah. And
Did
these
you
are
do
long. I mean, they're long, like translucent strings. Yeah, it's really
wow.
bizarre. Yeah, I
Wow.
had yet to see something like that. Yeah, so
So we are getting to really know you today. After
even
all
I
this.
have parasites. Yeah,
Hey,
everybody
listen,
has parasites.
I say that all the time. I mean, even coaches need coaches,
Yeah,
Doctors need doctors, psychiatrists need psychiatrists. Well, I don't know if we need
it's
a
so
psychiatrist,
true.
but
Yeah,
what I'm saying is that even the cobbler's children need shoes because they have no
that's
shoes. But what I'm saying is that it's so wonderful that you're trying these things. Have you said, okay, because we talked about four here. here. You had talked about that some are anti-aging. Are you saying that everything is anti-aging? Because when you get rid of those parasites, your body is going to be able to handle
There,
the
yeah.
everyday digestion, everyday stuff that's going on.
Definitely, to some degree, yes, all of them are kind of anti-aging because it's boosting and modulating your immune system. And, when you have inflammation, that's what ages you and things like that. However, there are certain peptides specifically for lengthening the telomeres. And so when you lengthen those, your lifespan is longer. And so that is an amazing marker. So there are different categories. So there's immune peptides, there are neurological peptides, there are injury type peptides. There's categories, and then there's the anti-aging longevity peptides, and that would be in that category. And then there's antimicrobials. So there are peptides directly to kill pathogen, and those are best used with people with like stealth pathogens. They have an infection, we can't find out where it's at. It just keeps showing up in their white blood cells, but we don't know where it's coming from. That would be a good peptide to use in that case. Mhm.
Any contraindication? Are there certain people that you would call you and you would say, you can't do
Yeah.
peptides?
Yeah, it depends on the peptide. So yeah, so like I said, with certain, patients that have active cancer, there's certain peptides you would not use. And
Mm.
the TB um,
4.
4 is one of them. The TB 500 is another one. Any growth hormones, stimulating growth hormones, you wouldn't use. And with the GLP ones, I wouldn't use that on someone with a history of eating disorders, and so there
Oh,
are things
wow. Yeah.
that you would be very cautious in using. And peptides are not your first line of defense. They come into play when other things have not worked that should work. And so, yeah, everybody needs an evaluation to see if it's, appropriate. So you give them the information and help them make that decision if that's the best route for them. But most of the time, the ones mostly that I use are very, very safe. There's not a whole lot of side effects with them, and most of them don't have any side effects, just side benefits. So yeah.
Well, I love it. I love it. And so I just want to remind you, all of you, to go to shoprightwayhealth.com if you're interested in this or other supplements that like Dr. Jen's immune kit, immunity kit, or just all her other products that she has in the shoprightwayhealth.com. But if you need to schedule an appointment, you can go to 404-474-2100. Let them know that Lily 20 for your consult. And if there's other things that you choose to do, maybe you can talk about other things that will work. When someone, Dr. Jen, when somebody, because we're almost out of time here, someone that is listening to this for the first time, what is your advice to them? Not that you're playing their doctor or anything like
Right.
that. It's not a doctor-patient consultation, but what are some of the things that someone might be experiencing that a peptide therapy treatment or whatever you want to call it would be like, oh yeah, now it's the time.
Yeah. And I think it's when you are struggling with pain, inflammation, brain fog, neurological issues, just a weakened immune system. You're getting sick all the time, and nothing that you have done is working.
Hmm.
When you have tried, high dose vitamin C, or you've tried this and tried that, and it just doesn't seem to be helping, I think that's the time that you consider using peptides because
Okay.
maybe it's a metabolic issue and the signaling process and your pathways are just not working. And so, as practitioners, we're always, and I think peptides are going to come into play more and more because of the state of the metabolic brokenness in our country. But because if you just treat on the outside and the system's broken, you're only going to get so far. So you really want to fix that system, that messaging, and then all the other supportive, supplements, dietary changes will work better for you. So,
Awesome.
yeah.
Awesome. This has been so good. I'm just so glad
Yeah.
that I've learned a little bit more about peptides. I am going to definitely call Rightway Health and Wellness to get started on my journey with peptides, because I really would like to learn more. And I really appreciate everything that you do and everything that you share. So thank you so much, Dr. Jen.
Thank you. I enjoy it as well. Thank you so much.
And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Jennifer Gramith wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
The opinions and advice expressed on the Lily and McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.